Hello everyone, I am Dr. Richa Bansal. I am a gynec oncosurgeon, that is female cancer specialist surgeon, also laparoscopic and robotic surgeon at Apollo Hospital, Navi Mumbai. Today I will give you some information on ovarian cancer and how we deal with these patients at our institute. Now, ovarian cancer is one of the most deadly of all gynecological cancers, and women with ovarian cancer need a very special treatment and care at not just upfront at the time of their diagnosis where they need surgery and chemotherapy, but also at the time of their relapse of the disease. So they do need special support and care at multiple stages of their disease. And ovarian cancer has been rightly said to be silent killer, or the cancer that whispers, because we've seen that majority of the women with early stage ovarian cancers have very little or absolutely no symptoms at all, or sometimes they may just have very subtle symptoms like just dull ache in the lower abdomen, or increased frequency of urination, or sometimes just subtle changes in their regular bowel habits, like sometimes constipation. And many a times these symptoms are just ignored by the women as being very non-specific or non-significant. And as a result of this, we see that not just in India, but also in majority of the Western world, this ovarian cancer is diagnosed in very advanced stages of the disease. And hence, it remains a priority to help women become aware of these symptoms, so that we can pick more and more of these cancers in early stages of the disease. So, what is the cornerstone of ovarian cancer treatment? So, that is cytoreductive surgery and chemotherapy. Now, the aim of this cytoreductive surgery is to take out all the tumor or the disease from the abdomen at the time of surgery itself. It normally entails removal of the uterus, both removal of both the ovaries, which are usually large ovarian masses in case of ovarian cancer. Then there is a curtain of fat in the abdomen, which we call omentum. So ovarian cancer very commonly spreads to omentum, so that needs to be removed. Many a times the lining of the abdomen, which we call as peritoneum, that is affected. So that also needs to be removed, and sometimes part of small intestine, a large intestine, and also the lymph glands in the abdomen need removal. Now, what is so special about the cytoreductive surgery is that the chances of women's survival and cure depend upon whether or not the complete tumor was excised from the abdomen at the time of surgery. So this highlights the importance on the surgical effort of the surgeon at the time of surgery to remove all the disease which is present in the abdomen. And in fact, it has been scientifically proven that whenever the surgery has been done by a trained gynec oncologist, the survival rates in these women have seen to be better as compared to when surgery has been done by a general surgeon or a general gynecologist. Now, this was about the surgery part. Now, what else can we offer our women apart from this supramajor surgery to improve and enhance their survival? So, one thing is Hypec. Now, evidence for the regarding the benefit of Hypec in a few selected cases of ovarian cancer has been recently accumulating. And what is Hypec? Hypec is delivery of heated chemotherapy inside the abdominal cavity at the time of surgery itself. So, the rationale behind Hypec is that it delivers chemotherapy locally inside the abdominal cavity where we want to treat the disease, and thus it takes care of all the microscopic cells, microscopic tumor cells, which cannot be seen with the naked eye and hence which cannot be removed by the surgery. So it has been seen that these microscopic cells are responsible for the actual relapse of the disease. So with Hypec, we take care of these microscopic cells, and hence this helps in enhancing the survival of women. And at Apollo, we have a dedicated infrastructure where we can provide such kind of advanced treatment to our ovarian cancer patients. Also, recently we have seen that the incidence of ovarian cancer has been rising in more and more younger women, and many a times these young women have not even completed their family. So, whenever such malignancy is seen in young women, treatment decisions have to be very critically made so that the fertility can be preserved without affecting their cancer outcome. Uh, so at Apollo, we have highly trained surgical, medical, and radiation oncologists in our oncology department. And if I were to speak about the surgical oncology department, it is the treatment that we offer is organ specific wise. So all the oncosurgeons are highly specialized in their field. So this is what I wanted to share with you all about ovarian cancer and recent developing role of Hypec in ovarian cancer. And I hope this information is useful to you all. Thank you so much.